Cerner was very helpful in allowing us to talk to other groups who were implementing Cerner, Intermountain Health being the big one. And the other thing that Cerner has been helpful, because it came along at the same time, is dealing with the Patriot Act and some of the data analytics that really doesn't allow things to come across the border.
Cerner has been an excellent partner with the hospital. First and foremost, the technology works, and the technology is the easy part. That allows us to focus in on the harder parts in and around clinical transformation, and the support, expertise, and guidance that the Cerner team has provided our hospital and our resources has led to great camaraderie and great respect.
The easiest part about implementing the EHR in the emergency department at North York was actually the training and the go live. And we attribute that because we had frontline staff and nurses and doctors that actually built the system. And it was intuitive. It wasn't staff adjusting to a system. It was a system that was adjusting to how staff worked in the emergency department.
The support I get from Cerner Lights On is great. It's very quick. They're very receptive to feedback and suggestions and opportunities for improvement. So occasionally I'll just say, you've just released this dashboard. It's fabulous. I love it. Thank you.
So Cerner helped us get to HIM Stage 7 by really providing us the platform for our electronic medical record. So when we implemented the Cerner Millennium solution, it was really with the goal of having a fully integrated electronic health record, one source of truth for our patient data.
The patient is not just the injury. The patient is not just a sore, twisted ankle. Behind that ankle is an 85-year-old woman who maybe has a history of diabetes and congestive heart failure, who maybe has a lot of support systems at home already in place. We need all of that information to make the right decision about whether or not we can send this woman home safely to ensure that she doesn't actually return the next day to the emergency department.
Using CPOE and the functionality of the clinical decision support built within the product, we've been able to prevent actual errors from occurring and making sure we're providing the right and evidence-based care for our patients.
We saw an increase in the number of potential mismatch alerts that were firing, and so potentially that's 900 adverse events where potentially the wrong patient may have received the wrong medication.
So we use Lights On to help us optimize our alerts and reduce alert fatigue in order to help our physicians and pharmacists who are using the system have more value-added alerts.
So the biggest benefit I've heard from patients is that people know what happened. People coming up to me, at events and who I would never have heard from before, home care nurses and other groups who say, today I have the entire written record and I'm talking to the patient and getting that full story and making a plan for their care at home. It's a dramatically different environment.
We're involved in the development plans for the new One Plan design, primarily to provide that mental health lens to the development efforts that Cerner is undertaking.
The best thing about Lights On is the opportunity that it gives our organization to use data for positive change.
Cerner has the ability to give us any solution that we have possibly put forward to any problem we've given them, but they're not going to force that down your throat. You have to ask for it, and once you ask for it and you partner with them, you're going to have an unbelievable journey.